The Presbyterian Church in Canada's Towards a World Without AIDS campaign is making a huge difference in people's lives. Since it was launched in June 2004, churches in Canada have rallied behind the effort, challenging their communities to respond. They raised over $1.5 million to support AIDS programs overseas and in Canada. The legacy from the campaign is being seen today in Malawi, one of the countries where the funds helped our partners scale up their response to the pandemic. Mulanje Mission Hospital, in the rural south of Malawi, was one partner that increased its outreach programs with funds from the campaign.
As a mission hospital, our catchment population is really below the poverty line. And that's why you'll find that most of the programs we offer them are really for those very poor people.
With a 21% HIV infection rate in communities already struggling with extreme poverty, the fabric of society itself has begun to break down.
Previously, in Malawi, we had a strong community bond that is disintegrating because the problem is just too big. The other families are not able to care for these children that are left. So you'll find most of them are abandoned at this time.
At the Mission Hospital's Orphan Training Center, guardians learn how to effectively care for orphans.
The guardians of the orphans, when they come, they stay here for 2 weeks. And in the first week, we teach them basic child care, how to feed the child, because most of them that come here, they are just babies, they're still breastfeeding. Now the mother is gone, we have to teach them how to administer the formula.
Doris Moffat has traveled 25 kilometers to seek help with her orphaned granddaughter, 9-month-old Tamara.
Most of the orphans come here with old women, their grandmothers that left childbearing a long time ago. So we also try to remind them of childhood illnesses, immunizations, and basic child health care. Yeah.
Participants at the center learn how to keep themselves and their babies healthy. Some are provided with formula to feed their babies.
The program as it is, we have also a follow-up program. So once the woman is discharged from here, she comes here every 2 weeks. So us, we are able also to see the child, how the child is going on. But in the 2 weeks that we don't see the child, the volunteers really find they are mostly able to cope because we continue supply the lactogen, or if the child is on the porridge, we provide the porridge for the child. Yeah.
The impact of AIDS on churches, who provide significant education, social, medical, and pastoral care, is enormous.
One of the biggest challenges is the HIV/AIDS epidemic because instead of concentrating on our work in the church, we are most of the time cheering the sick, conducting funerals. So that's one of the challenges.
In Malawi, the church's response has been comprehensive, from addressing root causes to meeting very basic needs. Creative dramas and workshops are used in churches, schools, and communities to teach people how HIV is and isn't spread, and to combat stigma and discrimination. Voluntary counseling and testing programs run by Presbyterian mission hospitals help people discover if they are living with HIV, so they can access care that will help them stay healthy. Home-based care volunteers have been trained to visit people who are sick, helping them with basic needs and medicines, as well as providing emotional and spiritual support. With antiretroviral drugs now more widely available in Malawi, people are living longer and more productive lives. Support groups help people living with HIV find ways to live life positively. But this is challenging work. Presbyterian Church in Canada mission staff, Glenn and Linda Inglis, have seen firsthand the devastating impacts of HIV and AIDS.
How many can a country bury? How many of your own society, your own families, your neighborhood, how many can you bury and still, you know, face the day? You're losing your family, you're losing your children, so you're raising your grandchildren.
The old folks who should be sitting in their courtyard in their village having the children bring them food, they are now out scrounging for food to try to feed their grandchildren.
Hope for Rebecca Niarenda, who has been struggling to feed and raise her grandchildren for the last 13 years, comes in seeing those children grow into adults who will help build a stronger Malawi.
We are 5 of us in this family, and we are staying with our grandmother only.
Nearby Ekwendeni Mission Hospital has helped the family survive by paying school fees, helping them with food through difficult times, and building them a new home with funds from the AIDS campaign.
They are paying fees for us, the whole family, we children, and they are helping us, giving us fertilizers, some soaps, I can say basic needs. This house, it was built last year. When they saw that we are acting like that the other house was not well, and then they thought to build this house for us.
Beauty is now fulfilling her dream of becoming a nurse.
Because here in Malawi, there are few nurses and there are more patients, so I commit myself so that I should save the lives of others.
The HIV/AIDS pandemic has really hurt this country. The police, the army, nurses, teachers in particular, the emergent middle class was decimated, absolutely decimated. So, you know, Malawi just lost a huge number of very productive people in that period.
Investing in young people who can make a long-term difference in the fight against AIDS in Malawi has been one of the strategies of the Towards a World Without AIDS campaign. Like Beauty, Benson lost his parents and had to drop out of school until the Blantyre Synod helped him finish his primary and secondary education.
My father passed away in 1999, so I have to left school for a while to assist my mother as well as my fellow brothers and sisters. 2 years later, my mother followed the suit, they passed away as well. So, but then in 2001, there's this organization from Blantyre Synod which assisted me as well as my family.
The Synod is now sending Benson to medical college, where he is living out his dreams of helping his family and his country.
I believe that I worked much here in Malawi because mostly I want to assist my country, 1. 2, I want to make sure that my family, I'll take care of my family while I'm present. And also I want to assist other people. Possibly I will join the project, the Blantyre Synod, so that I can assist other people who also need some sort of help. I want to thank the project, the Blantyre Synod itself, and also you, our sponsors from Canada. You are doing a great job indeed, and you are assisting us. And on behalf of my friends who also assisted, I want to thank you.
The Towards a World Without AIDS campaign is now part of the overall work of the Presbyterian Church in Canada. Presbyterian World Service and Development continues to support long-term development projects working to reduce the impact of HIV and AIDS. Funds from Presbyterians Sharing help our partner churches around the world with pastoral care and spiritual and leadership development to cope with the AIDS epidemic. The fight against AIDS is not over. We are making a difference. Get involved by supporting Presbyterian World Service and Development and Presbyterians Sharing.